What's up, Facebook fam? It's your girl Joanna, the Soul Stringer, coming to you with May Lupus Awareness Month's Fact a Day every day. Today is day 21, and we're still discussing do's and don'ts when dealing with lupus patients or autoimmune patients. My do for today is when asking lupus patients out for events or outings, do consider the environment. There are a lot of factors that could totally derail a good time for a lupus patient. One of them would be if it is an outside event, patients are very sensitive to the sun. So you want to be conscious of making sure that there's shading and somewhere nice and cool for them to sit if they're going to be outside. You also want to be considerate if it's inside of the climate and temperature inside the building as well, because if it's too cold, that could also potentially cause issues for patients. Also, where you're parking, you want to make sure you're parking close enough so that patients won't have to walk too far, because some patients are not as mobile or active as others. Also, if you can't park close enough, make sure you're dropping them at the door before you park. Whatever you do, you want to make sure that they are the most comfortable, and you also want to remind them if they're outside to wear sunscreen, even if it's an overcast day. Patients, again, are really sensitive to the sun, so you want to make sure that you're conscious of the environment when you ask them out. Okay, my don't for today is please do not tell patients to not claim their illness. Now, don't get me wrong. I'm all for positive reinforcement, positive thoughts, and all those things that cause patients to feel better about themselves and, in essence, fight their illness or disease. However, whether they claim it or not, patients know pain on a very, very personal level. It's very real for them. So telling them not to claim it is not going to rid them of the pain that they feel while coping with this disease. So you just want to be conscious and supportive. Sometimes if you don't know what to say, maybe not saying anything is a better option. But definitely don't tell them to claim it. And also you want to be conscious of the fact that there are many who have actually lost family members to this disease. So telling them not to claim it probably would not feel really good to them when they've already lost someone. So just be conscious of that. That's my don't. Again, we're talking about watching your tongue, watching your lips. Be careful. Don't say anything that could be offensive to a patient or insensitive. So just be conscious of that. And as far as my do, make sure you consider the environment. That's my fact for today. I thank you guys for always continuing to share. I'll be back tomorrow with more do's and don'ts, or any other fact that I feel like would be beneficial to supporters and patients alike. So I will see you guys tomorrow. Peace.